Today I'm here to discuss about pilonidal sinus, which is a very rare but problematic disease. My name is Dr. Nipanjan Ghosh, and I am a consultant general and laparoscopic surgeon practicing at Apollo Multi-Speciality Hospital, Kolkata. Pilonidal sinus is a very rare disease. Its incidence is less than 1%. It is more common in young males, young hairy males. How it presents? It presents as a small pit-like thing above the buttocks in the natal cleft. Many people are unaware of it, that it is present. When it becomes symptomatic, the patient comes to know that there is something wrong in that area. How does the patient presents? It presents as a pit. Sometimes a fluid builds up in that pit and a cyst forms, which is known as pilonidal cyst. If the cyst gets infected, then an abscess develops. That means a pus starts coming out. Now, what exactly is pilonidal sinus? What is the cause? The exact cause is not known, but as I said, that it occurs more commonly in hairy males. The hair in the region of the buttock, because of friction, like prolonged sitting on the chair, goes inside the hair follicles. That means it gets stuck and causes irritation and inflammation, and a abscess occurs, which is known as pilonidal abscess. Now, when the abscess gets drained by itself, or any doctor drains it, that means when the pus comes out, a hole-like thing or a tunnel-like thing develops in that area, which is known as pilonidal sinus. Now, there are very treatment modalities for pilonidal sinus. Initially, when a cyst develops, the doctor may prescribe you antibiotics to reduce the infection, but that is not the permanent treatment. When you give antibiotics, the inflammation and infection decreases and patient becomes well, but again it recurs. Now, what is the permanent cure for pilonidal sinus? When a sinus develops, initially when there is abscess, the surgeon drains it and takes off all the infection in that area, and a large shallow-like cavity develops, which is dressed every day so that the wound heals from below upwards and the wound gets covered. There is a tedious process. It takes sometimes up to 1 month to heal, depending upon the size of the cavity. When pilonidal sinus develops, there is a tunnel-like thing develops which keeps on draining fluid. In that case, there are various treatment modalities. The commonest is just excising the whole area containing that tube-like or sinus tracts and letting it heal by itself from below upwards, which takes 1 month or sometimes more than 1.5 months to heal completely. Other less troublesome and good methods are just excising the area and covering it with sutures. Suturing, there is suturing, but it has got a high recurrence rate, up to 20%. The best modality is a flap closure. That means when you excise the whole area and take the tissue from adjacent area and cover that part, that has got less recurrence rate. And in vogue, a new treatment modality is laser. That is still instrumental, not a standard method of practice even now, and has got a high recurrence rate. Thank you.